Okay, hello everyone. My name is Bianca Niemezewski Silveira. I'm a medical student from Brazil, and I'm really happy to say that I'll be coordinating the Rural Cafe today, and it's our 35th Rural Family Medicine Cafe. And today we are going to have a nice chat about oral health. So I am in my sixth year here in south of Brazil. I'm still a medical student, almost a young doctor, and I'm really happy to be here. I've participated from lots of cafes. It's been a long time that I was not here, so I'm really happy to be here. And I would like to hear a little bit about you too. Can you introduce yourselves?
Okay, hello everybody. My name is Ava Bult. I'm from Estonia and I'm a young dentist.
Sure, I don't mind. I'll go.
Oh, okay. Keep going, Eva.
So yes, I'm very excited about this Rural Cafe. I'm also representing the International Association of Dental Students. So hopefully this will be a very fruitful and interesting conversation around oral health.
Thank you. Amber?
Hello, my name's Amber. I'm a junior doctor currently working in North Wales in acute medicine. I've got an interest in rural family medicine and have participated in a few cafes, but haven't been able to make one this year so far. So I'm really
Oh,
happy to be here
nice.
and talk about something that I don't really know much about, which is oral health.
Okay, right. Thank you, Amber. So we still have some participants that may come during our conversation. We have Mokshada from India, and we have two other dental professionals that may enter during this conversation. So I think that Eva may help us and may start some points. I was having a quick read about this point because just as Amber, I don't really know a lot about oral health. And the moment that I was reading some of the difficulties of oral health in rural and remote areas, lots of them seems to be really similar to the medical problems about geographic isolation, about lack of adequate transportation, about social differences, and the difficulty of access to the system and oral health system or health system as a whole. But I was interesting to while I was reading, it was written about lack of fluoride community water supply. This I think is a really special thing about oral health. I don't know if you know about it, or if you could talk a little bit of it to us. What do you think about?
Yes, thank you very much. So this is actually a very good question and a very good topic to discuss because fluoridation of drinking water is one of the main measures nowadays to, let's say, to minimize or to lower the occurrence of caries and cavities, and it's really beneficial in communities. So there is a fixed limit that is good to have inside the drinking water, but there are two great kind of sides, problematic sides. One is having excess amounts of fluorides inside water, which can lead to very severe bone and skeletal malformations. And on the other side, if there is a lack of fluoridated water, then this means that the communities have teeth with very weak enamel. So the overall idea of fluoride is to make the outer layer of the tooth, so the enamel, to be more resistant against all kinds of acidic attacks and also bacterial contamination. So kind of it makes the outer layer stronger. So you don't get cavities that quick as you would normally. So in this sense, the communities that are lacking kind of access to fluorides, let's say from example from the drinking water, it is an issue, of course, most certainly.
I see. So I don't know. Do you live in a urban city or a rural city? I don't know what it is about your experiences in rural realities. Could you talk a little bit about it, and if you know any other difficulties in rural areas than this one that I just said as an example?
So there are actually a lots of issues when we talk about rural areas, remote areas, because from one side, of course, there is a great lack of knowledge and also lack of healthcare workers and lack of dentists and professionals. One reason because oral health and dental care is very specific and very technical. Then usually family doctors, GPs, they don't know what to do. They can't do anything. From the other side, also in the cases where, for example, community health workers can at least provide some very general or let's say emergency help to some communities which are difficult to access otherwise, or they can give them some medicines, anything. Then in the case of dental problems, this is of very little help, unfortunately. So it's definitely necessary to get access to a professional, an oral care professional. So this is one of the issues when we discuss, for example, children and their oral care. Then one side is, so what you mentioned, one thing is, let's say the community, for example, the water with the fluoride also, but one of the, like, there are definitely more topics. For example, one is brushing, like the hygiene, overall hygiene. In rural areas, there are families that don't have a single toothbrush, they don't clean their teeth, or what's often even worse is that they have one brush for, let's say, the whole family. So this means very severe bacterial contamination. So they share the bacteria in case some of them have, let's say, a lower tolerance or towards let's say, malicious bacteria, and also maybe some family members have like severe caries or cavities in their mouth. So this will all be given then to the kids. So because the bacterial, it's pretty much a contamination if you have the caries in your mouth. So so that is one of the issues. And most certainly, a couple of years ago, I went to Nepal to volunteer. And there it was very well, you could see very well that the communities or the families that were, let's say, let's say, okay, they were poorer with less success also to maybe food and some luxurious, maybe luxurious items or things regarding food, roughly. It was very well seen that the children who had came from a better, wealthier family, they had more cavities in their mouths because they had access to candies. So it was like you could see really well that the kids who were skinny and they had like healthy teeth, but the ones who actually said as well that yes, I do eat candies, then it was really, really bad. So the problem is that in these communities also the kind of the knowledge doesn't arrive before the items do, so they get access to all these very sweet things and beverages, but on the other side they don't get access to fluoridated water, they don't get access to brushes, so yes, so they it's that is very problematic as well.
Really interesting. While you were talking, I just took some notes because I got some questions. before, the first one that I would like to ask is just for you and for Amber, is about access. I don't know about your countries, but here in Brazil, Amber can talk about both countries. I don't know your own and the one that you are living now, but here in Brazil, we have family health, and we have the primary health have some teams of health professionals, and the minimum one is with one family doctor, one nurse, two technical nurses. I don't know how to say this in English, sorry. And we have a specific professional that we call community agent. That is the person responsible for doing the link between the community and the health team. And this is the minimum one team. From the beginning, it was from 1996, this family health program here in Brazil. And after that, I don't know the exactly information. I can talk about what I've heard. And I know that after that, we have had some additional laws and decrees. And I've heard about one that said that it would be also part of the minimal team have the oral health team that would be a dentistry. I don't know if I'm sorry if I'm not using the right words, please correct me, but the dentistry, and two techniques, two people who have the knowledge about dentistry, but they have not done the graduation. It's just a technical education. So here in Brazil, that I as I know, we have this law that we should have at least one oral health team in the primary health units. But unfortunately, this is not a reality. This is just a law, and it's like what should be. I've done some internships in primary health care here in my state, and one of them we had a really nice oral health team, and the population could have a really nice access, and they had a really good working team. It was a really nice one, but I didn't have really that much of um, working with them. I just knew that they were there and they were doing a nice job, because just as you said, we don't really know about it in medicine. It's really, really different. So I would like about your countries. How is it in your countries? How is the access to oral health in primary health? Is it easy? Isn't it? Is it possible to the people go straight to the oral health professional, or if they have to go to a family doctor appointment before, or how is it?
Would Amber like to
So I
start?
can talk about I'll start with the Virgin Islands first. So our our oh, is it okay if I just chime in because I've got to go to work in about 5 minutes? Okay, so in the Virgin Islands, the dental and the medicine and the medical are separated. However, they do work very closely with the general practice clinics, purely because of the way that they're organized within each of the districts. So each clinic will have, a regular family medicine practice, but they will also have a dentist visiting from time to time. Now, you don't need to go through the family medical doctor to get a dental appointment. The dentist it's a separate thing. Access on our sister islands is still a bit tricky. So you have the dentist sort of visiting I think it should be twice a month, but if they have other commitments or if something happens, then it goes down to, once a month, once every 2 months, that sort of thing. Our government has a really good campaign for young people, so like school-age children, um, to get their oral hygiene up to scratch. They'll give out toothpaste, they'll give out toothbrushes, that sort of thing in all of the districts. Um, However, when you get sort of to teenage years, it also there's no support system, so it's sort of up to parents and the individual to maintain dental health. But there are still lots of campaigns to make sure that you get your teeth checked regularly, you see a dental hygienist, try to stay informed on what causes things like gingivitis, for example, and for some strange reason, braces have become really popular in the Caribbean. So you'll see lots of people sort of in their 20s, 30s with braces. So it's definitely more of an aesthetic interest than an actual health interest. In the UK, it's quite similar. So dental and medical are completely separated. Um, the big division is that the health coverage is free on the national health system, but dental stuff isn't. So what you find is there are a lot more people who are up to scratch with their medical health, but their dental not so much. It tends to be more affluent people who can pay for private checkups that tends to happen. And now, on that note, I'm really sorry, but I have to go because I'm working on nights on call tonight. But it's been a really interesting conversation, the bit that I have heard. And I'll be following you guys along later on in my shift on YouTube. And if it's still going, I'll drop some questions in on Twitter.
Okay, it's okay. Good job. And good luck in your shift. Thank you, Amber.
Thank you. Bye-bye.
Bye.
Okay, so that was very interesting hearing about how it's there. I come from a country, Estonia, so it's quite up north, close to Finland and Sweden. So in general, we have quite a good healthcare system. We have like a general health insurance for everybody, but it covers pretty much only medical things, medical problems. So dentistry is pretty much 100% private, which means that if you can pay, then you can go. Otherwise, there's no way. We have some little, very, very small, like I would say discounts, but roughly, yes, it's only in private hands, and this is the issue in most of the countries in Europe, actually. And in the States, it's even worse, as we all know. So everything is very very private, and it costs quite a lot. So this is like this is one of the issues. The other issues, and because dentistry in general in the world is in private hands, kind of. So there are separate like little companies. Then it's very hard to integrate it actually into the primary healthcare system, and it's very difficult also when there are global talks around universal health coverage, because it's very difficult to, if for example, if the governments pay for medical care, then they don't can pay for dental care in like most of the countries. So it's really hard to do this kind of collaboration and to try to bring kind of dentistry closer to all communities. So it's kind of sad that there are a lot of communities that don't have any access, but there at least governments are trying like really hard to at least get some prevention and prophylaxis there. Like at least when teaching the people, training maybe the community health workers, also giving out toothbrushes and things. But in the kind of the middle and high income countries, the problem is still that it's only in private hands. So you have access, but you don't have money. So that is something that's very difficult and different when we talk about dentistry. But I'm most certain and sure that these things can be overcome as well. And like it just needs a very very like very good knowledge and maybe very lots of work and discussions around these topics, how to integrate dentistry into primary healthcare and also into universal health coverage.
Yes, I see. So if I understood right, in your country you have a nice health system and you
Hmm.
have universal coverage, but dental oral health is not into this system.
Exactly, exactly.
You only have access to oral health if you can pay for it.
Yes, yes.
This is
Children, yes,
so
this is nice.
weird.
Yes, and this is a very, like, very, very common in most of the European countries. Like,
I didn't know that.
yeah,
Wow.
so it's very, very nice when you talked also that about Brazil having these like kind of groups, or teams. And of course, it's very nice that it's also written somewhere to have like oral health professionals or like a dentist in the team. I think the first step is actually writing it down. So even if it's impossible to do it, then still like, they will try at least. So this is like a head start to actually understand that this is an issue that the medical doctors can't deal with these dental problems, and it is not their job. So like it's necessary definitely to include also the oral health professionals into these
Yeah,
teams.
and this is a little bit crazy because like it's part of the health, like it's part of people health. So how can you separate oral health from this health system that has universal coverage and you don't have it in oral health? This is like it's crazy
Hmm.
because, but it's really it's really nice to talk about it with you and to know that I didn't know about it. I didn't know about it in Europe. I just heard that lots of European countries they have universal coverage just as Brazil, but usually you have a better system than ours because we still have lots of problems and we don't have financial enough. But it's I think it's really good. We know that it's not perfect yet. Lots of places we don't have the oral health team, but we still have the certain that it's written in the law that it should have. It
Hmm.
should be there. So it's not there sometimes because we don't have enough financial support, but it should. Well, so yeah. And for example, I would not think about writing uh, 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 oops, I forgot how to say this. I would not think about writing an experience
Hmm.
text about it saying that we do have it here because I just didn't know that it was not common in the other countries.
Well, yeah, yeah. The thing is in Europe that we have like a lot of like it depends very much on the country as well, but
Yeah.
usually it works so that dentistry is in private hands, but the government pays like a little bit. So some treatments are either for free or they are like subsidized somehow. So this is
Yeah,
yeah,
but it's
depending
not
on the
enough,
country.
right?
No.
Some families they don't have a brush, and this is one of the other questions that I wrote down. Just a curiosity, because here in Brazil, it's kind of part of our culture that we always try to manage things and try to find different ways to manage when we don't have enough structure or enough material, or we always are trying to find a way to deal with things. And I was thinking I've been in some families that they also didn't have a toothbrush, and I was thinking maybe I don't know, have you ever think about any other alternative, like how could we instruct the families that if they don't have a toothbrush and they cannot buy it and we don't have it to give it to them, how would be an alternative to have oral hygiene without a toothbrush? How would it be possible? Is it
Well,
a way?
it's let's say there are also in some communities it's popular to have these. I don't know what's the term for them, but they look um, like little sticks, pretty much. Like it looks like a wooden stick, so it's also
Okay.
possible to kind of brush your teeth with that thing. And that is also something that in like rural areas is
Mm.
kind of common that like at least they brush with some sticks or some things that they find if they don't have brushes. But the problem with oral hygiene is that like it's very very necessary to brush the teeth because otherwise, firstly there comes gingivitis, the inflammation of the
Mm-hmm.
gums, and then later on it moves on to the bone, and when it moves to the bone then your
Mm-hmm.
teeth start moving and they fall off.
Yeah.
So this is actually the problem, like the issue with oral health, kind of oral hygiene. So it's
Yeah.
still very necessary to brush the teeth.
Yeah.
There
Yeah.
can be, of course, alternatives like what they can find, like sticks, or they have like it's very very interesting as well to see from some exhibitions or some countries like what people use. But yeah, it's unfortunately or fortunately still necessary to clean regularly teeth and gums.
Yeah. Yeah. I see. Okay. Another question that I had here. When you were talking about sharing the toothbrush, when different people share the same toothbrush, I was thinking that we do have our own flora, our own bacterial flora
Hmm.
in our mouth. If different people from the same family, they share the same toothbrush, they may be sharing different bacteria, right? And
Hmm. Yes.
if one is okay for me, maybe not the okay for you. So it could
Hmm.
be a way to be contaminating each other, isn't it?
Yes, it is. So the thing is that there are so far over 700 different kinds of bacteria found in the mouth. So
Wow.
it's a lot.
Yeah.
And basically, like there are like a lot of groups, of course, but if we take it really roughly, then there are bacteria that cause like gingivitis and like periodontal inflammation. So the structures that keep your tooth in your mouth, and the other is that cause diseases to your teeth in the sense that you get like cavities and caries. So the problem is that usually, like when, for example, speaking about young children, then like they are very kind of open to all kinds of microfloral floral changes as well. So in the case, for example, their mother has like a bad, let's say, a lot of periodontal bacteria and
Mm-hmm.
pathogens, then like if they will be shared to the children, that the child gets the maybe periodontal infection. If the father has a lot of cavities, a high like amount of cariogenic bacteria, then the children gets also those. So in this sense, it's quite bad. Of course, it depends a little bit about genetics as well.
Yeah.
The genetical side in oral care, it's not new, but it's still like very interesting because we're not that sure how big is the role of saliva, for example, and the overall general immune system. But this also plays a role because some, for example, in families where there are twins, one children has like everything, all the information, and the other doesn't have a thing, and they come from the same family. So this is something regarding the immune system for sure as well. So there are these interesting sides to it as well. But in general, yes, you can share. If you brush with one brush, then you share the bacteria, and share also all the diseases that come with the bacteria.
Yeah, I see. Okay. Right. And the last question that I had written here until now is also about the system. Um, I really like public health, so I think it's really nice to share the experiences from different countries and different realities. Here in Brazil, our family health, primary care system, we family doctors and nurses, we have the visiting. We go to visit some families when they cannot go to the health unit. The professionals, the health professionals, they go to the family's house. I don't know. I really don't know. I'm curious now. Actually, I don't know how it is in Brazil about oral professionals. I don't know if they go because I know that you have lots of structural things that you need, right? I can take my stethoscope, I can take some of the instruments, and I can have an appointment in the patient's house, but I don't know what about you. And is it possible, or maybe just for maybe health education, health prevention, how does it work? Do you have this kind of visiting moments or not? How is it in your country?
So yes, I agree that because we have a lot of like things we use in our work, then it's maybe a little bit difficult. But we do have family visits, so it is possible. For example, if a surgeon has to go, then he or she can take all the things with him, together, and just go. And then if like extractions, it's completely possible to do those. Also, in a during a family kind of a visit. Also, regarding, for example, if somebody needs like dentures or like prosthodontics, the prosthesis, then it's also possible partially, for example, to go like if how can I put it, fake teeth, like
Oh,
yeah,
okay,
yeah, yeah,
okay.
yeah,
Fake
dentures.
teeth. Okay,
Exactly,
okay.
fake teeth is a good term. So
Okay. How is
also
the formal way to say this?
denture.
Denture. Okay,
The
okay.
denture is like yeah, like a full.
Yeah, I got it. Yeah, okay.
So it's also possible then, for example, to go like to homes and like let's say take the impression, go back and then bring the ready, like the final work to them.
Done.
And
Yeah.
also when we talk actually or when we think about voluntary work, then those projects are also usually run with um, like minimal resources. So we don't have usually the birds and the things and everything you have in a modern dental unit. So it's also possible to have manual instruments and also some filling materials that are like that are possible to use. So in this sense, actually, then most of the things in dentistry can be done, also during visits. It's possible. Yeah, we have the instruments and the things, so it's of course not so convenient and not so comfortable, but like if it's necessary, then it's possible. Yeah.
Yeah, this is good to know. I didn't know that you could do so many things. Nice to know that. And what about your experience? Have you had rural experiences?
Mhm.
And how is your experiences until now?
So I consider maybe my best rural experience when I was in Nepal, volunteering
Mm,
for a few weeks. So there we saw quite a lot of patients. Mostly we worked on like we had extractions done on them, and also some other procedures, and also like another big part was then visiting schools and teaching the children how to brush, what to eat. So we also like kind of did dental checkups for the kids. So we saw what is the overall, condition of their mouths and their teeth. So this was quite interesting because Nepal is still considered like quite a developing country. They have a lot of people there, a lot of people without any access to healthcare services, and even like, of course, to dentists as well. So in this case, those voluntary projects they work out quite well, and I believe that at least they have some uh, an important contribution to the communities there. Speaking about my own country, I've worked also in the countryside, so which is also different compared to this like city life. Now I'm living and working in like our capital, so everything is super modern. But I believe that every professional needs to have this like experience and this knowledge, that and this understanding as well, to always stay very humble and to understand that communities are on a very different level. When you speak about it on a global scale and also on national scale. So yeah, it's kind of important to understand these problems, to discuss this. This is also why I believe this rural cafe idea is really wonderful, so everybody can share their ideas and how things are in their countries, what are their previous experiences and views on these things. So yes, it's important to go and look around and understand that you're not alone and that
Yes.
you have a role to play.
Yes, yes. That was the main idea when Mayara, who was the girl who created this idea. The main idea was that to share experiences and see that you're not alone, not only in the difficulties, but also in when you can have some solutions, and to chat and to share all these situations. And I just remembered when you were mentioning some of the difficulties of the oral health in rural and remote areas. You mentioned also the lack of oral professionals. We, of course, talk about it a lot here in Rural Family Medicine Cafe, because in rural family medicine, we have also this problem of lack of family doctors in these areas. And sometimes, lots of times actually, we talk about it. We talk about trying to find some solutions to bring people to go to rural areas, how to stimulate people to go there. We have mentioned some of it. We have some countries that they have had lots of success in their strategies. One of them, Roger Strasser, is one of our um, uh, how can I say, supporters. He's really nice. He's lots of time he's with us in the rural cafes, and he has already shared with us some of his experiences in Canada. And they had, for example, they have rural internships during graduation moments with the medical students. And we also talk about having, for example, um, uh, internship during the residency program, that they should be in rural areas as well, so they can show people that the rural areas, they exist, and they are different from urban areas with all of the technologies, right? And the other point that we also talk about is how to bring people from rural to the medical courses, to medical graduation. Because when people are from rural, they may have a larger chance to go back with this medical background, go back to rural area, and then we can have more people working there. Have Do you talk about it in dentistry? Do you talk about it in your association? How is it for you? Do you have strategies to increase oral professionals in these areas? Do you talk about it? How is it in your profession?
So the thing is that, of course, there are discussions around it. Mostly, what is a little bit sad is that mostly the discussions are on kind of a national level. So let's say when there is a country that has lack of those professionals, then they talk about it. But on a global scale, it's not that, like, maybe not as much as it could be. In most of the countries, exactly this issue that you mentioned. So people go to work in the big cities, and there's nobody to work in the rural areas, in the countryside, and it's very hard to motivate also. And several countries also, several universities have made these plans regarding dentistry as well. So when you graduate, you have to work, for example, 2 years in a specific location in a rural area. So this solves the problem, like in a sense it helps, but those people usually they don't stay there. So the largest, kind of the biggest issue is to really, how I see it as well, is to really have like the dentist.
Retain them.
Yes,
Yeah.
exactly. To get, like, to make them stay there and to kind of make them become a part of the community. So this is also some issue, especially in the low middle income countries, where the patients, they feel that the doctors and also the dentists, they are like really high up, and they are not like they don't kind of equalize themselves at all, or they like that, and they feel that the doctors are not their friends, but rather some specialists, who just do their job. And this is also another issue, that because everybody wants to flee away from the rural areas to the big cities to earn more money, to have more whatever entertainment, everything, the nicer lives. So it's difficult. And one the point that you said as well is that if we would like motivate people coming from rural areas to go and like study this occupation, and maybe they will come back to their communities because they are like integrated already in those communities. But that's also tricky, because like the schools are usually outside, and it's quite expensive to move from your rural area to go to a big city to study. Of course, they would like to like do it, and probably like to come back as well, but it is problematic with the health workforce. And regarding oral care also, there's a huge lack of access, and in several countries, for example in Rwanda, I think there's like one dentist per 1 million people. So this is really crazy in my country. Yes, so, and there are several countries like that. So yeah, so there are some statistics, but it's very hard to change these things. Like the dental schools there are very new. They haven't managed to train that many people yet. So one way would be to, of course, establish schools with some foreign aid, foreign help, maybe have also some, like a lot of volunteering projects there. But this is not a sustainable solution, kind of. So a sustainable way would be to have funds and have universities to train also, and kind of to motivate the people to stay there. But it is like a huge problem, and I think that problem is also goes outside of healthcare, and is actually regarding all kinds of different spheres in life. How to kind of make the people stay in their communities, and like help the communities to also move forward and get a better future.
Yeah. One dentist to 1 million.
Yes, I think it
Wow.
was one per 800,000, but like roughly, yeah, a
Yeah,
million.
yeah,
And there
yeah,
are the
it's and you said that the dentist schools, they are new. How is that?
like the thing is, there we are in contact also with their dental student association, which also I think it's 2 or 3 years old only. But of course, the universities are older. So the problem is that in those areas, because there are so small numbers of dentists, then there are also even smaller numbers of people who can actually train, and be professors. So if you
Mm.
open a university there, then where can you find the professors from? So this is also one of the reasons why let's say the courses are quite small. They would need like several hundreds of people, in 1 year. But because dentistry is also a very technical specialty, and you need to get all the technical skills, and then you have to have, all like a dental chair, with everything, all the equipment, and this like is very, very expensive. So it's really expensive to have big dental universities actually. So yeah, there are several issues. It's very, very practical, and it's very costly for
Yeah.
the universities.
Yeah, it's really expensive. I've heard that here, at least in my state, here in the south of Brazil, that I know, dental course is the most expensive one. It's the equipment is absolutely expensive, so it's really difficult people uh, to get in the college, to get in the faculty. It's
Mm-hmm.
hard to pass the exams and start the course because it's lots of people want to do it. Here it's common to have lots of people who wants to do this course, but usually people who wants it are people who are already rich, because they
Mm-hmm.
have to have money enough to buy the equipment that is really, really expensive. And then after that, it's common they open like private
Mm-hmm.
clinics, and they are not interested in public system because it's too expensive, and sometimes our public health system, it doesn't give enough equipment and they cannot work and they are not satisfied, and it's like a looping of difficulties. Yeah.
Yes, I completely agree. Also, well, regarding Brazil, I don't know if you know this, but the biggest number of dentists in the world are in Brazil, if you talk about countries, yeah.
But
Like
you
the
mean
largest number.
the absolute number
Just
or the number per people?
no, just the absolute number because it's a huge country. So not the number, of course, per people, it's not enough, as in a lot of countries. So, but yes, and also it's like when we talk about big countries like Brazil, then the level is also very different. Like there are one of the best top clinics in the world regarding dentistry are in Brazil, for example, and also yeah, so there's a very very high level and like a very low level as well. But this is very often the issue as well. And yeah, it's like, and the thing is also that it's very different. What are the problems regarding like health workforce when we talk about dentistry and probably about medicine as well? Maybe there are like there are some countries in Europe, for example, where there are too many dentists as well, so they don't have enough patients. Especially when we talk about small countries, and like for example, my country is like that. So we
Wow.
have our population is only 1.3 million. So like the whole country is really small. So we have a little bit too many dentists, but it's not bad. But yeah, and then on the other side we have these countries where there are like no dentists at all. So this is also different and difficult to tackle. That's kind of it has to be a special approach like based on the country and its needs. But on the other side, like as a whole global world, we need to move towards, also having dentistry and primary healthcare and yeah, universal health coverage. So it's a lot of issues, but hopefully, it can be possible to kind of work these things out. And also from our organizational side, we really try hard to like educate our students and make them understand that these are issues that they should also talk about in their countries and try to give as much as they can to make it better.
Yeah. May I ask one last question?
Sure.
Okay. I was thinking now. I have some friends who does the dentist course as well, and I was thinking that just as in medicine, as you can be specialized in so many other
Hmm.
points of the occupation, and as for example, I was thinking about it when you were talking about being enough professionals per people. Here in Brazil, we have, if I'm not wrong, I'm almost right about it, but if I'm not wrong, we have enough doctors per people, but
Hmm.
but the doctors, they are not where they should. Like, we do have too many doctors
Yes.
in urban area,
Hmm.
and we do have too many specialists. I mean, not general. We don't
Hmm.
have enough family doctors, but we
Hmm.
have too many neurologists, dermatologists, and all of these
Hmm.
specialties. So we have too many specialties, but not a generalist one. But so we kind of have enough doctors, like in the absolute number, but it's
Hmm.
not enough in the practical life. And so we do have to stimulate doctors to do the family medicine specialization, because that's the specialty that we have lack of professionals. And what is it, how is it about in dentistry? Do you have like a family health specialty or specialization? How is it for you all? Because I know that you can be from prevention in primary care health, or you can be like a surgeon and do lots of
Implants.
complexity
Hmm.
things. So
Stuff.
how is it in this point of? Yeah.
So, yes, so it's the same thing with dentistry, and also, for example, in my country, that everybody is located in the big cities, and in the countryside, there aren't enough general dentists, I would say, because yeah, like a general dentist, I think you can compare it like with a family doctor. So they kind
Yep.
of do everything, but they're not specialists in like anything. So they don't fix like they don't stick to only one thing. But regarding specialists, it depends very much on the country. It depends on the regulations that the governments have set, how many specialized people, like personnel, they need every year. In my country, with the specializations, it should be quite okay, but it's yeah, it's very it depends very much how it is. But mostly yes, like the lack of having general dentists in the countryside and in rural areas, that is an issue. And of course, everybody wants specialization, so that can also lead to the issue where we have a lot of specialized people doing very specific little things, but on the other side, not that many general doctors. And one way how this is kind of being solved when we talk about dentistry is that there are these people called dental therapists. So a dental therapist is not exactly a dentist, but they can do quite a lot of procedures. So in general, the way what dentists are where maybe dentistry should be moving in the future is so that the dentist or the person, yes, who has a dental degree is rather like a person who diagnoses and makes the treatment plan, and then the manual work is done by the dental therapists and also oral hygienists who make like do cleanings mostly. So it should be kind of categorized in that sense, so as to make the dentist like look a little bit in a more general way, in a more like general medical way, also on oral health. So there would be an oral health specialist, aka dentist. The dentist is not such a good term, so maybe an oral health professional, and then the dental therapist would be the one doing the manual work, most of the manual work. And then also there would be specialists who would then do the very like high end thing, let's say very difficult surgeries or things like that. So this is kind of the way that some countries are trying to develop towards. For example, in the UK, they're training the dental therapists, and also in the northern countries, it's a very rather popular thing as well. Of course, this has to be very well regulated, who can do
Mm.
what, and that can be very tricky. But in the case of good regulations, this could be a very good way towards where to move, and also to make oral care like more a part of kind of medicine, like maybe a subspecialty or something.
Mm.
So the doctors would actually be doctors who diagnose and who make the plans, and then the manual work is kind of done by the therapists and the hygienists.
Yeah, it's interesting. I have never heard about it before. It's really nice point. Maybe we do have in Brazil, but I didn't know yet, so I may check it.
Mhm, mhm,
So I think that's it. We have reached our time. I
mhm.
really, really, really would like to thank you. Your participation was amazing. I have learned so much. It was really nice. I'm sure that everyone who is going to watch it offline, then it's going to be there on YouTube. They are going to enjoy it lots and lots. So thank you so much.
Thank you so much as well. It was very, very nice, a nice experience, and yes, I hope you will have something around oral care maybe sometime in the future as well.
Yes, please feel always comfortable, always welcome to come again. Our next edition is going to be on October 18th of October, and it's going to be our Seoul edition. It's going to be in a family medicine event in Seoul. Is going to
Oh,
be live there. Then we can participate on Facebook, Twitter, and email. Everyone is invited. And also, it's going to be our birthday. And so, please, everyone, feel invited to be with us in the next one. Okay.
wonderful.
Thank you. Thank you so much. So, see you.
Thank you. Bye.
Bye bye.